Thank you.
Thanks, Prof. And good afternoon, everyone, and welcome. Welcome, Lewis. Thank you for coming through all the way from Uganda. So, Dr. Mulumba is a lawyer and advocate of the High Court of Uganda. He's currently the Director General of AFIA Haiti, a leading African institute that generates and builds advocacy capacities in health, human rights, and sexual reproductive health, and finds using Africentric approaches within national and global context, within a national global context. So he previously Center for Health, Life and Development, leading a team that undertook groundbreaking legal advocacy work, including major constitutional litigation that created precedents on advancing the rights of to health in Uganda. So his work focuses on law, health, and human rights. So quite honored to have him today, and he'll be speaking about towards reproductive justice in the African region, the role of the colonial and Afrocentric approach.
Thank you so much. Good afternoon, everyone. It's such a pleasure to be here. Over the last 12 years, I have been at the center of health, human rights, and sexual reproductive and rights for a long time. So I started off with the Center for Health, Human Rights and Development, commonly known as SPH, where I was leading a team that was at the front line of litigating sexual reproductive and rights, not just litigations, but also looking at health systems work and how this intersects with the law generally. And we've used human rights for a long time as part of our work. So after 12 years, I realized that partly what I was doing, I think I had achieved the mission, and I had to move on to other things. So together with the Board of Trustees, we've been thinking about how else can we contribute to the wider African conversations on health, human rights, and sexual reproductive rights. And at such a time, there has been a lot of discussions on things like decolonization and how Africa needs to think about, coming up with its own solutions, so its problems. And within this, one of the interesting areas is the normative frameworks we've been using in health, human rights, and sexual reproductive rights generally, and how these normative frameworks are African and how they do apply to the African context. And in one of those areas that I've done a lot of work with my colleagues is sexual reproductive rights, quite contested in many African countries. The questions have been, where are we failing as African countries? Where can we do better as African countries? As academics, as activists, are the normative frameworks that are currently informing work sufficiently? Could they be better? Could we do much better than the way we are doing? And we've decided.
Sorry, the people online are just asking if you could talk a bit louder.
Louder, okay, sorry.
Shout
So I'm going to shout. It is better. So one of the questions that we've been having is, how do we apply the normative frameworks we've been using much more to ensure that they do solve the African problems that we are currently facing? And at AFIA Haki, where we are, we've started with the area that we are comfortable with. That's really looking at what has been the impact of these litigations we've been seeing over time on the contested areas of sexual reproductive health and rights. And I want to share, I'll start by really the end, which is like the conclusion, and you'll see why I am coming back to that. So there have been a series of litigations that have been happening on the continent, and these are worth our reflections to sort of think about why are some of the African judges thinking about sexual reproductive and rights the way they are thinking about it. For a very long time, the narrative has been that many African countries are not progressive, and it's just a few.
but we don't interrogate sufficiently why we have these, contested areas being handled the way they are being contested. And I share a few cases as part of the beginning of my presentation. So in one of the cases where they have been challenging the anti-sodomy laws in Botswana, the judges came up with a judgment, and within the judgment, they are actually digging up the history of these anti-sodomy laws and how they are coming onto the books of Botswana. And in this case, the judges indicated that with the advent of colonialism, the offense of sodomy was imported into a number of British colonies in the 17th and 20th century. And according to them, the constitution of Botswana needs to be read as a living document and a dynamic charter of progressive human rights, serving the past, the present, but also the future of the unborn constitutional subjects. So they are moving away from the traditional understanding of the letter of the law that has been guiding judicial decisions to actually move to the history and make decisions on a very contested area, not just Botswana, but my own country, Uganda, where I come from, on LGBTI. But very similarly, we see the same trend in other countries. In the Kenyan case of FIDA Kenya and 4 others versus the Attorney General, where the government of Kenya was being challenged for withdrawing standards and guidelines that are supposed to be guiding health professionals on dealing with cases of unsafe abortions. As a result of this, a case was brought before courts of law where a minor had tried to access to safe and legal abortion services, but they couldn't, and she lost her life. So the group that sued actually argued that if the government had provided the standards and guidelines as part of the guiding operations of the medical professions, probably this would not have been a big issue. Traditionally, in interpreting a law like that, what would happen is that the judges would be stuck to the law. But in this judgment, as you read it, you get a feeling that the judges are actually of a considered view that the social context of Kenya is very important in making a decision around this. So they moved away still from the constitution, and they indicated that the issues that the case was raising do not arise in a vacuum, but in a lived experience of people of Kenya who voted for the constitution with the rights and limitations that contain it. So you still see that the human rights argument is important, but it's not the single consideration for the judges in coming up with a decision like this, but the social context within which the case is brought in Kenya became very important. And it has not stopped there. In Rwanda, again, I'm using a case of access to safe and legal abortion where a 13-year-old was intoxicated and then thereafter raped. There was a huge conversation when she actually wanted to access services. She conceived and wanted to access services of safe abortion. So while there were legal contestations on whether the person who had raped her had actually been charged to be a basis for her to receive the care that she needed, this person had not been charged. The judges were of the considered view that no matter the result of the charge, whether the person has been charged or not, what was actually important to consider in such a case is the individual minor of 13-year-old and the circumstances surrounding her. And the judges still cited 2 social issues. One, the fact that this minor was going to be shameful amongst her classmates if she had continued with the pregnancy in class, and the fact that it was important for her to continue with her lessons was a reasonable issue that needed to be considered as part of granting her the right to access safe legal abortion. So again, it's not necessarily the human rights argument that is raised, but it's the social issue and the contextual issue that became a consideration. And then in the last case that I share in Zimbabwe, Mipingule went through, again, sexual violence. As a result of a robbery, she was raped. And when she was raped, she quickly went into a medical facility to access, what do they call the medication? PEP, to access PEP, but also to have an emergency pill to avoid a pregnancy to happen. And when she actually went to the facility, the medical person said, I can't give you this unless you have a police report. And then, this was in April. She goes to get a police report, and the person that is responsible for her case is not there. And then by the time she secures the police report to get the emergency treatment, it's beyond the 72 hours. And the health professional says, I cannot give you the emergency treatment because it's over 72 hours and it will not be effective. And now when they tested her later in May, they actually found out that she had conceived. So she goes to receive a termination, and she goes to the health professionals. And now they tell her, you have to actually access, you have to make sure that you have a medical certificate that allows you to be able to terminate. Still ping pong in the legal system, she couldn't get the certificate. And by the time it was September, when she had secured it, the pregnancy had moved to a stage where it was unsafe to actually secure a termination of pregnancy. So she goes to court, and she wants to hold the system accountable. Of course, the judges considered the international human rights framework, but it was not enabling enough for them to be able to make a judgment. So they went with negligence as one of the trials. So they held the health professionals as negligent, who had refused to give her the services that she needed in the beginning. But the court noted that it was still her responsibility to know how to deal with the system, to be able to access both the emergency pill and the PEP. So you can see that despite the fact that the human rights frameworks have actually been existing for a long time, and that we've been talking about access to safe and legal abortion, or even LGBTI issues as part of the human rights framework, they have not been delivering sufficiently in many African countries. And in a few, there have also been successful cases that we've litigated that we've seen. But what about cases that we see that are successful, not necessarily because of the human rights language? What do they call us to think about differently from the way we've been thinking about things? I think we need to revisit the history of the African society, but also think about sexual reproductive health and rights more broadly, much more than we've been thinking about it. Sexual reproductive health and rights is as old as our society. And these contestations on sexual reproductive health and rights have actually been part of our society for a long time. So no matter the frameworks that we develop today, if we don't revisit them as part of our cultures, as part of our religious norms and taboos, it's going to be very difficult for us to deal with them, because historically, these have been dealt with as part of culture, as part of norms and part of taboos. And therefore, the questions as to whether the current policy frameworks have been framed within the cultural context where the African society is, I think becomes very important. It's not just an academic discussion, because this is a conversation that is life-threatening. It determines who receives the service, how they receive the service, and whether this service is actually life-saving for them. So we need to think about them in terms of our programming, in terms of our funding, but also in terms of the impact of the communities that we are serving. I think very many people have been woken up by the current court decisions that are coming up. Dobbs versus Jackson that overturned Roe versus Wade in the US was a great wake-up call for many people to actually know that even seemingly a settled legal issue is not settled within the context of society. And therefore, it is important that we move beyond the comfort zones that we get within the laws and think about the history and think about the legacies that have been created over time and continue to impact on sexual reproductive health and rights, and how we need to refocus our resources and refocus our work beyond the legal rights that we have overly emphasized for a long time, and beyond the human rights that we have overly emphasized for a long time. I have always and I've been telling people that, the evolution of reproductive rights is just like the way we see religion, which is moving beyond the Old Testament to a New Testament. And maybe later on, we shall be even having a Third Testament beyond what we see. The moralization of sexual reproductive health and rights historically has been engraved, and this we know it. We know that from the past, the issues of sexual reproductive health and rights were moral, and the religious leaders were actually the anchors and the force of sexual reproductive health and rights. But this slowly moved to a democratic issue, and people began to think that even bedroom issues had to be subjected to democracy at a certain time. So part of the reports that we saw in the UK, we are actually emphasizing that even moral facets had to be part of the law. And if something is not part of the law, then it's not meeting the popular tolerance at a time when they were having the conversations. And as a result, it was subjected to criminal punishments. So by the time we got colonized, it was at a phase when actually even the democratic issues had moved now to offenses, where the moral issues, the issues that were part of norms of the UK had been legislated into penal codes. And these penal codes, got into India and then left India and came to many of the colonial states that I'm part of, in Uganda and South Africa is also part of. So we saw that sexual reproductive health and rights also became part of offenses, and the fact that people were emphasizing individual rights, but criminalizing people that were going against part of these practices. You need to note that as early as 1960, 1967, the UK that has imposed the moralization and the criminalization of the sexual acts, which we still hold onto our laws very firmly in many African countries, moved away from the criminal approach. But many of the post-colonial countries are still stuck with the same laws. And it's not just the laws, but it has entered part of society, and it has been engraved as part of society. So people think, and our leaders continue to think, that it's actually okay to criminalize sexual activity in the way they are criminalizing it. But this is a colonial mind that continues to be occupying the minds of many people in Africa. You will note that after a certain point, we had so many population conferences that began to discuss sexual reproductive health and rights beyond being an offense and beyond being, population and birth control. But this still has not changed the mark, even within the human rights framework and the application of the human rights principles of privacy, of choice, and everything else. They have changed, but they have not changed things sufficiently. What are we supposed to be doing? What are we supposed to be doing differently? And I'll be talking about civil society, but very many civil society organizations that would ideally be playing a role to change things and make sure that things are acting differently. They have actually been formed as part of, the theory of birth control, which also happened within the history. And I've called that a historical sin that we've continued to import in our societies and which we need to do differently. And I think the US, with the Black communities that were there, they give us some bit of learning, even to date, where they were actually arguing that human rights are there, but they are not sufficient to address the historical injustices that were existing. So they proposed the reproductive justice framework. And within the reproductive justice framework, there are three key elements that are very important for sexual reproductive health and rights, which I think that as the African continent, we need to revisit. The right not to have a child. Many of the contested issues on the African continent are within the right not to have a child. How do you, deal with contraceptives? How do you deal with access to safe and legal abortions? How do you deal with the LGBTI communities, but also the right to have a child? There are issues where people have been forcefully sterilized. And part of the, forceful sterilization is part of the bad history that we actually saw, where there was population anxiety in Europe and in the US, and in slave, as part of slave trade, where they deemed you as a slave that, was capable of, giving other breeds of slaves, better breeds or poor breeds of slaves, then you would be sterilized. how do we deal with these issues that have been existing? But also the third component, the right to parent a child in an environment that is enabling, I think is also becoming something that is very important that we need to think about in Africa. And I don't think that the current frameworks within which we work are comprehensively addressing the three elements. And as I'll be arguing, it's something that we need to think about. And probably this is why the judges in the African courts in some of the areas are beginning to interrogate these issues deeper than we've been seeing before. So for us, the reproductive justice framework is becoming important because first, it is addressing the reproductive justice injustices that we've seen historically. The belief in superiority of races begins to be very important, and the formation of civil society organizations at a time that we are fronting part of this, I think needs to be challenged, including going back to those civil society organizations to revisit their own beliefs and their own start. You know, the work on forced sterilization that we saw because of population anxiety needs to be thought, you know, and rethought and seeing how we could do things much better. You know, slave trade that we saw, where our own leaders were actually forced to be part of people that were forcefully administering treatments on sexually transmitted diseases, as I'll be sharing, also needs to be thought about very deeply. You know, colonization itself, as I've indicated, becomes important, and the legacy that it created all over Africa, I think needs to be thought. We need to think about the Africa that we had before, the pre-colonial Africa. What are those some of the positive narratives that we can pick from the pre-colonial Africa that I think we lost along the way? I don't think that Africa was static. I don't think that it was uniform. The way we are meant to believe now, I think the importance of children was very important in Africa, but there were ways in which some of these questions were answered, because I think there were indigenous knowledge that actually existed on contraceptives and pregnancy. And thinking about this in some of the African societies becomes very important. How do we improve some of these to also reduce the resistance that we are seeing in interventions on sexual reproductive health and rights? You know, there were ways in which premarital pregnancy was dealt with as part of social norms. Many of these have been either criminalized or have been thrown away. But in some of the societies where we come from, people still hanged on to them. And we are not creating an enabling environment where the positive narratives of these can actually come onto the front and they become part of the issues that we deal with. How were things like abortion dealt with? How were things like LGBTI dealt with? I don't think that they were dealt with criminal laws and offenses like what we are seeing today. There were no ways in which these were actually dealt with within the African society, but we've not studied this enough. We have put everything together and thrown it away as part of the barbaric practices that we've coiled over time of the African society. And I think that us relooking back onto some of the positive narratives is going to be important. The distortions that came with colonization, I think, need to be revisited and unpacked as part of the system. The thinking that, you know, tropical medicine is going to apply to deal with the African problems as part of civilization, as part of salvation, and as part of progress, I think it needs to be rethought. And we need to think about it as practitioners in academia, but also activists. We need to think about the social norms that were destroyed in favor of offenses, you know, bigamy, adultery, and how we are dealing with some of these things are things that we need to deal with as we move ahead. The criminalization of sexual reproductive health and rights needs to be rethought. And I think the African judges are beginning to push back in some of the decisions that they are making to actually indicate that we are not going to be able to deal with some of these social issues through criminal laws. You know, the importation of legislation from outside needs to be questioned. Very many countries, including my own country, you know, the Public Health Act that we've been using in COVID-19 has been as old as 70, 80 years old. And every time we do a small amendment of it, we don't go to the structural issues that we need to deal with. You know, the law on STDs, I remember, I forget the name that they used to use, but the law that controls STDs is a colonial legislation. The mental health legislation for a long time has been very historically colonial. But in UK, where many of these laws came that actually created offenses, have long been changed. And our governments are taking much longer to actually do it. And it's part of the decolonization process that needs to happen. The enforcement of heterosexual norms that we saw for a long time in our health systems, I think needs to be rethought. For a very, very long time, a doctor was a male, a nurse was a female. And these are historical things that came for a long time. And now people go to get, you know, services, sometimes find it too difficult to break this. You know, the very first senior doctors who are specialists in the context of a country like Uganda, where I come from, are still alive. They have been young female, you know, doctors. You know, it's lately that they are becoming. Think about judges. The female judge, first of all, get a judge. So the entire system gets male dominated, not because of the African history per se, but part of it is the colonial history that was created, that created these heterosexual, you know, norms that have continued to exist and impact on us. The colonial health system, as I've indicated, continues to impact on us. You know, the non-profit delivery of health systems is coming to almost 40% of health service delivery by missionary founded hospitals. They are still existing and they are still operating within the same normative framework. So, allowing them to continue delivering health on sexual reproductive health and rights in the system the way they used to do becomes a bit of a problem. As I've said, the criminalization is a big problem. The demographic anxiety that existed continues to inform the family planning conversations and the entire family planning associations that we have created all the way from the US through to our governments. And the role of us as civil society, I think is important to rethink. Even when we saw the post-colonial Africa, there were good things that began to change, but we lost some of this because of the international agendas that have been set. Think about the population control conferences that have existed for a long time. Very few of them have addressed the injustices, the historical injustices that have existed, but they have created a normative thinking that we need to begin from where we are. We don't have to dig back the history. And I think sometimes that's where we get it wrong. To think that the individual is the way we see them and we must solve their problems as we see them. I think we begin to lose it, and part of the society begins to oppose it. Things like LGBTI, things like access to safe and legal abortions are beyond the individual that we see. They are part of the history that has not been addressed, that we need to think about and address. Even when we had the Population Control Conference in Cairo in 1994, the redefinition of some of these things has been very slow. You know, it has been very slow. The African Union pronouncements on women's rights itself has not engaged very sufficiently on contested issues that are impacting on women, but rather economic empowerment, which is important, but does not address the historical wrongs that we've seen over the time. So I think that we need to rethink ourselves as civil society organizations, as academics, to actually dig deep down in the history and find out what went wrong and where did it go wrong. What should we be doing different? And I don't mean to say that we need to be rewriting the history. I think it's not about rewriting the history, but we need to speak to the continent's socioeconomic, political, and cultural context much more than we do lately. I think the application of human rights frameworks wholesomely, the way they are without studying the continent's contextual and political and cultural issues, sometimes makes us miss the opportunity that we would have. The understanding and accounting for realities and the structure of men and women and why sometimes we have lived lives of sexual reproductive health and rights the way they are, I think becomes important. We cannot achieve reproductive autonomy and freedom if we do not link our lives back to the economic, social, and cultural inequalities that have been existing for a long time. The intersectional analysis is going to be very, very important. And this is why we've actually been proposing that we need to think about a paradigm that re-examines the epistemic and the practical implementation premise on which sexual reproductive health and rights work is constructed. The framework is not to rewrite Africa's history, but I think is to relook at African history and refocus on approaches that are important. First, we need to have more appreciative questioning and co-creation of solutions to really deal with the African problems on sexual reproductive health and rights. And we propose 4 ways in which this is important. That's where I will end. I think first, how do we document positive African narratives on sexual reproductive health and rights? As I've indicated, all the time we talk about African judges and the decisions that are coming out on the African continent. We criticize the African judicial systems, but we never look out for these positive judgments, which becomes a problem and a missed opportunity. So let's document more positive African narratives on sexual reproductive health and rights from history is going to be important. Second, how do we work with more African institutions to actually help in the co-creation of innovations and solutions? Our political leaders believe in so much the global normative frameworks and the global spaces. And when it comes to the African Union, there's not enough investment that is going into the African Union and investment into the African institutions. I think there is a lot of potential on the African continent. The same conversations we have on SDGs should be the same conversation that we have on the African agenda, development agenda that we see. I don't think that they're at the same level in terms of investment and in terms of focus. What's the African health agenda? And how is the African health agenda addressing some of these things? And how are we engaging the African institutions? I think it's something that we need to think about. Then fourth, how do we enable African CSOs and other actors to actually complement the work of the African institutions? We have a historical problem here where much of the agenda of the African CSOs itself is determined by where the funding is coming from. We never sit back to actually think about what is practical for us and how we need to do things differently. So areas of social inclusion and social accountability sometimes get missing. So this is why we need to revisit the African CSOs, the academia and everything else to sort of determine the African agenda and see that things are done differently. And then lastly, the African individuals and experts in the field. We've had the challenge for a long time. Everyone who becomes an expert in Africa ends up leaving the continent to go and work for the outside world. How we will deal with this, we don't know how we'll deal with it, but it's important that we continue to value the solidarity of the African individuals, because we just don't have experts that have studied too much, to a level of PhDs, but we also have experts with lived experience that we always live out in our communities, especially on sexual reproductive health and rights. We don't value them as much. There are not much studies that are focusing on them, and it becomes a missed opportunity. So me, together with the group that we am now working with, we do appreciate the human rights frameworks. We do appreciate the other normative frameworks we've been using for a long time. And we believe that these need to continue, but over and above them, I think an African thinking needs to be mainstreamed, the way we've mainstreamed other things that have always historically been left behind, disability, HIV/AIDS, and all those other things that are causing social injustices. I think it's the same way in which the African thinking needs to move, and we think about things very differently. It's the only way we are going to be able to actually begin addressing the contested issues of sexual reproductive health and rights. And as I've said, the litigation agenda is already giving us an opportunity with the cases that I've shared earlier on. I'll stop there and invite any questions. Thank you very much.
Thanks, Moses. I think there's one question there, and I just need to see online. Maybe you can start with that one.
Thank you very much, Doctor.
There's one online, yeah.
So I have 3 questions, but I'll make them quick and effective. So the first question is with regards to, you mentioned that there have been litigation in Uganda, for example. Do I need to increase my own voice also? Oh, okay, cool. That there was litigation in Uganda. We know that Uganda is one of those places, one of those hot spots where the decriminalization of sodomy laws is a contested issue, a political issue, a health rights issue. So I was hoping that you would point out cases where the judiciary is doing that kind of unpacking and not simply following the predominant political narrative. So if there's such examples, could you share them? That's one. And then the second one is also using another hotspot, Ghana, where what is interesting is that not only is the issue of decolonization political, but even the language of decolonization is now being weaponized in support of a colonial agenda. So you have MPs who are saying America cannot impose its own will on us and withhold aid based on the fact that we are not willing to give up on the legislation that we want, because they are currently trying to legislate to criminalize same-sex unions. And in pushing that narrative, they are saying we want to be able to determine for ourselves. I, as an MP, am representing my constituency and I have the legitimate mandate of my constituency. So how does one navigate the use of decolonial language to even push the agenda that is counter to the end goals of ultimate decolonization? And then I've forgotten the question when I remember it now.
Do you want to take another one, or are you happy? I think we've got a hand online. Pancho, you can go ahead.
Yeah.
Unmute and go ahead.
Yeah. I wanted to ask, what do you do in the context of where this idea of sexual reproductive health is not well defined? And I was hoping I would get a good definition because like giving the example of Zambia recently decided to say they're not going to call it sexual and reproductive health, they're only going to call it reproductive health. Because if it's sexual, then it's about gay and lesbian and transgender people, which they criminalize and persecute. So I'm just wondering, how can we define it? And I'm also just a tad skeptical about a return to this pre-colonial Africa, but I don't know, is the definition to be found there? Thank you.
Thanks, Pancho. You can take the first round.
It's not the last one. That's fine.
Yeah.
Yeah. So that's the last point you made. And so when you made the point around utilizing more tools that go beyond human rights, and I wonder if by that admission, we're not already conceding the realm of human rights to...
We have access to Pombilis.
Online?
I think they're muted.
They've muted now.
Yeah.
Okay. Apologies. Go ahead.
So if my fear is that by doing that, there is an assumption that the realm of human rights is inherently Western. And so we are trying to use other tools than human rights that, while effective, is Western. And we both know the contestations around relativity of human rights and all of that. And so I was wondering, isn't it possible to conceive of human rights as already inherently African, and then by the expansion of those definitions of what human rights is in the African framework, as opposed to thinking of it as an effective tool that we need to kind of set aside for the purpose of decoloniality?
Take that one.
Thank you so much. I'll start with the last one. It captures quite a number of issues. I think that the conversation is not on replacing human rights.
Okay.
And it's not on accepting that human rights has failed. I think the conversation is on accepting the importance of rights and that it's been very vital for the journey where we've come from. But over and above the human rights language, there are some historical contextual issues that we have left out for long. And I was sharing and reflecting on this week. If you think about sexual reproductive health and rights and where it's placed within the place of human rights, if you think about it as a civil political rights, tick, there has been a lot of achievement in that. But if you think about it as an economic, social, and cultural right, it's still subject to progressive realization. It's subject to all those weaknesses for a long time. But I think we are capable of interpreting it differently. And this is what we are calling upon the judges. If you're interpreting questions of sexual reproductive health and rights, think about the context in which sexual reproductive health and rights language is actually being used. So for me, it's human rights plus, not the recognition that human rights are not important. And I also think that we need to push back in the conversations, which I call simplistic conversations, that, continue to highlight the fact that human rights language is a colonial language. I think we accept that it's a global norm. Because it's a global accepted norm, like everything else, it's applied differently across the countries. And because of equity considerations, because of historical considerations, it's increasingly becoming important that as we interpret rights, we actually look at the context within which the human rights are being applied. And we welcome, the criticisms that have been on for long on human rights, as you've rightly pointed out. But these are simple binaries that should not blind us on the main issue that we need to be addressing. I think one area where we have actually, on the African continent, where we have buried ourselves so much in backwardness is sexual reproductive health and rights, where everything that we bring, we call it Western. And we actually forget that it's part of society, that it's been part of society. In my own language, LGBTI has a traditional name. BCA is the name we call it. Of course, it's the way it is, it's stigmatizing. But the mere fact that even in my language it is existing indicates that it has been there for long. And for me, that's the positive narrative that I need to look out to this, rather than saying it's just a Western concept, which I don't think that I agree with. And again, I don't want to be misunderstood. There was a question on returning to pre-colonial. It's not a matter of returning to pre-colonial wholesome. And I'm one of those that don't believe that we need to actually periodize ourselves in pre-colonial, colonial, and post-colonial, because societies have been existing for long and they have been evolving for a long time. But I believe that there are lessons that we can't throw away, that we are existing before the colonial period. And I think those are lessons that we need to pick up. We've been blindfolded and made to think about that anything that is before the colonial period in Africa is dark and therefore is not important. And I think it's part of the decolonization that we need to have, to actually know that Africa existed and there were positive things that were there. We can throw away the negative and we pick up the positive. In the same way, in the colonial mind that we were having, there are very many negative things that were existing that we actually need to throw away, which are part of the penal codes that we currently implement. And it becomes a problem. I think part of the other questions that you raised were the language that is used and weaponizing. I think that's why I say we need to interpret it very differently. Very many African leaders hide into Pan-Africanism. What is Pan-Africanism? We have only interpreted it from a political and trade sense, but we've not interpreted it from a sexual reproductive health and rights sense. And for me, the positive narrative and the work that we have to do is how do we interpret sexual reproductive health and rights as part of Pan-Africanism? What does it actually mean? Such that we avoid the misinterpretation and the weaponizing that we currently see. And then lastly, yes, very true. I come from a country where there has been a lot of use of sodomy laws in the context of Uganda. I've just highlighted the case of Botswana. The last time when we had the same act in Uganda, we never the judiciary never had the opportunity to intersect itself and interact on the issues of LGBTI. The issue was thrown out because of procedural aspects and Parliament not having enough quorum. Let's see, our role as activists is to bring these issues before the courts of law and raise awareness with the judiciary and the powers that may be to see that things are done a little bit differently. Yeah, thank you.
Yes, can you just. Who gave the comment?
From Asha. Asha.
Asha, would you like to speak to the comment? You can unmute. Then I don't have to read it. Asha? Okay.
I'll have to read it.
So women and sexual reproductive health and human rights intervention are explicitly interconnected with racism and global health. At this point in time, as key stakeholders in the course and the global health decolonization struggle, we should start to pose realistic questions regarding the relationship between the current health policies and how they remove the scars left by colonialism, since they are well within our knowledge. I'm not able to speak. Okay. I think it's more of a comment. But if you could just comment on that. And on the floor. You can go while everyone is still thinking.
So I think that the recognition that the current discussions on racism and decolonization are connected, I totally agree with it. When you think about the role of Africa and how things have been, and Africa's connection to the US and the current conversations on racism, I think it's a beginning point. Why are we even talking about race in the first place? It's people that left Africa and crossed the other side. How they is an entire wrong process that happened, and how they are treated when they cross the other side, I think is part of the history that we need to deal with. So those that cross the other side, they are dealing with racism and issues there. And the same issues, some of them that they are raising the other side, are actually manifesting this side through calling for decolonization and saying, you know, this unfair treatment, unjustified treatment based on grounds that are not acceptable, I think is something that we need to think about. But also, I think the conversation globally, especially in global health, I think has been tested much more with COVID-19, where, you know, we saw that beyond racism, people are thinking about nationalism much more than they think about global. And it brings into conversation the importance of globalization and what it actually means for global health. Is it simply a global security issue, like we've seen the global conversations that are overly focused on security and protection of everyone else, and making sure that when COVID-19 breaks out or any other pandemic, people are locked where they are? Or is it a question of solidarity, genuine solidarity that we need to see? I don't think that with vaccine distribution and what we saw is actually demonstrating the globalization that we talk about. And I totally agree that as we talk about decolonization, as we talk about racism, the global nature of things needs to be rethought. And there are great lessons that we can pick from the pandemic and COVID-19. And the Africanness in racism is important to interrogate. That entire history in the US, in Europe, that existed, it started on the African continent, you know, in many ways. And therefore, we cannot negate what that means. As we leave that period, what was actually left and shattered on the continent needs to be discussed. At the same time, the impact of the people that were moved to the other side and how they continue to be treated and dealt with continues to be important, especially in the face of the global health crisis that we are currently having.
Lynn has a question for you. You can go ahead, Lynn.
Hi, thanks so much. This has been a really fantastic presentation and a lot to think about. So I work for the LGBT plus health division at Desmond Tutu Health Foundation and work quite closely with a bunch of LGBT plus civil society organizations here in South Africa. And I guess my question speaks around solidarity and collective action and what we can really do. I mean, specifically around the Ugandan act that's been passed. I mean, when it happened, there was a big outcry and a lot of civil society organizations mobilized here. I mean, we watched a parliament, we handed over a memorandum, but, you know, there wasn't really an outcome. We didn't get much government support from it. And I guess my question is kind of around how we as civil society organizations here in South Africa, where we do have a more liberal constitution, can kind of organize and support other African countries in progressing and realizing these rights, also realizing that we have a lot to do here in South Africa still.
Thank you so much. I think the solidarity question is very important, especially on contested LGBTI issues on the African continent. And it's one of the areas where we actually need to demonstrate as a continent that sometimes it begins on the continent, and that solidarity is important. I began by sharing the case of Botswana. I think the judicial systems have a lot of similarities. With the common law system, you know, across many African countries, what actually is decided in a common law country elsewhere has a high impact of informing the judicial system elsewhere. So part of the solidarity really is to make sure that we produce good jurisprudence and push back on some of these. So part of the solidarity could begin there because our judicial systems in one or another are interrelated. Our judges meet and they have conversation. But also as civil society, I think there is a lot of support that is needed for the LGBTI community to be able to push back and use the African solidarity mechanisms to actually indicate that we are discussing about Ubuntu issues. How have you navigated this in South Africa? How have you navigated this in Botswana or Rwanda or any other country on the African continent? And how do we make sure that we actually import this on the Ugandan side? Because in many cases, some of the arguments that are actually raised on LGBT, say, no, it's anti-African. And therefore, the solidarity that is required on the African continent is around that. But also the African institutions. Are we seeing more pronouncements from the African Union? Are we seeing more solidarity on our sub-regional entities? We belong to the East African community. Are we using the East African community to actually argue? Are we using the SADC to raise jurisprudence and raise policy positions that would inform the Ugandan government? But I also think that more directly as civil society, you know, issuing statements and engaging the UN system and other systems is going to be very important. So solidarity is very important. We just have to be very innovative as activists to actually know that we are touching on issues that require African solidarity much more before we even go out of the African continent. Yeah.
So, thanks very much. So it was really great. So I want to comment about solidarity because in a way you haven't articulated something I think that we've spoken about, and it's about what Africa could bring to rethinking human rights as a concept of collective, of being in solidarity with other people, Ubuntu. So you were in the MPH class where there was a severe attack on the individualized notion of human rights as reinforcing privilege. And we know that's true. I mean, it can do that. So, but on the other hand, you know, human rights can also work differently. And isn't that what an African reconceptualization of human rights can really make a difference? We saw with COVID.
Yeah.
Solidarity was in every public statement, but the act of solidarity was nowhere.
Yeah. Yeah.
So,
And I totally agree. I think there have been many ways in which the African continent, continent has reconceptualized human rights, right from the international instruments that we've passed, from the treaty through to the protocol on women, protocols on children, and other African instruments that we've seen that are protecting group rights. I think there is African-based interpretation, and there have been decisions also at the African level, which are very important and construed within the Ubuntu concept. I think these are things that we need to get into and think much more. I think people that are doing studies, we need to see how African governments are also reporting on their obligations as part of the African Union and the commitments that they have made at the African Union. And how do we amplify this? And how do we support? There was the African peer review mechanisms, which for a long time we've not taken as seriously as we ought to be taking them. But these are areas of solidarity where people in South Africa can help the Ugandan team, the people in Uganda can help the team in Botswana and collectively, and a lot of learning. I have seen that the West African countries are actually making a lot of progress with engaging the African Union. Think about Senegal, a lot of engagements. Think about Nigeria at the African Union level, but not so much progress at a national level. And within the East African community, I see that we are engaging a lot of our courts, we are engaging them a lot in Kenya, in Uganda, but we are not engaging the African Union level. So the solidarity of even studying where particular African countries are engaging more at a regional level versus where we are actually engaging more at a country level is something that we need to think about very seriously when it comes to sexual reproductive health and rights, and as part of advancing reproductive justice on the African continent.
Just a further comment to the point around solidarity. So when you were mentioning the fact that judges meet, I just thought that apart from the regional and national solidarity, there's also room for interdisciplinary solidarity. So I know, for example, in the Faculty of Law where I'm from, that there is a center whose primary work, all they do is basically bring judges from the African region together, give them training, give them packages, judges where there's internet access limitations. They provide them with packets of judgments so that when they go to the hinterland to provide judgments, they are not constrained by, oh, I don't have access to the constitution or that. So I was wondering whether in exploring interdisciplinary engagement, your center, for example, could work with that kind of center and then say, oh, come and give a talk to those judges, where you have all the judges from like East Africa and Southern Africa gathered together and make that pitch to them around, oh, this is what your colleagues in this area are doing. Have you considered that in your judgment? So it was just something that you said it. And
totally agree. A few weeks ago, we had the litigation baraza where we are discussing the same issues. A baraza is a Swahili word that means in a community meeting. So we had the litigation community meeting where practitioners from about 7-8 African countries came together with judges and magistrates, and we are having conversations. And I could tell that there is a lot of learning for Uganda, a lot of learning for Malawi, a lot of learning for Nigeria, which is very important. And I think it's not just for the judiciary, but also doctors and how they are dealing with some of these issues is very important. If you're sharing experiences of dealing with LGBTI, if you're sharing experiences of dealing with access to safe and legal abortions as doctors, as gynecologists, I think the associations learning from each other is something that's very important. Catalyzing that is something that we need to do much more than we've been doing. And for me, it's part of the Africentric approaches that we are talking about, where I think as African-based entities, we need to come together much more and deal with some of these contested issues in a much better way. And to me, it's the decolonization. That's what we call decolonizing. If we have an old legislation on public health, if we have ban all legislation on the Penal Code Act, how do we come to South Africa to pick lessons? What has worked, what has not worked? How do we go to Kenya? How do we go to Somalia? How do we go to, any other African country? I think that's lacking. You actually meet colleagues in the UN much more in Geneva than you meet them on the continent. And this is where the beginning of our problems is. When we are there, we all lament about the problems. But when we are here, where we are supposed to be actually learning with each other, and it becomes political decisions that I think we need to do better. For Uganda to come to South Africa to apply for a visa, it's much harder to get a South African visa than yes. And that's the solidarity that we are talking about. Some of the solidarity is about political decisions that we actually need to do better. Our profession should not find it so difficult to actually learn from each other, from the legal, from the medical, and other practices that are key. Thank you very much.
Thank you. Thank you
so much.
I mean, the meeting day would later, so I'm sure.
So the name of sending it to TGRU.
DGRE.
TGRU.
Governance.
Democratic Governance, something unit. Yeah, I think.
Well, thank you so much, everyone, for coming through in person and everybody online. If you have any further questions or comments, we're happy to provide Moses' email address as well. So, and of course, you've got Providence London here as well. Thanks, and I think it's good afternoon, everyone. Thank you.